And every day we report updated figures showing the growing number of coronavirus cases and deaths in our state, our community, in the region. But there are survivors. Most people with COVID-19 will survive. And that's the story we're starting with tonight. 13 ABC's Micaela Marshall meeting a survivor today. She's live now with the exclusive story. Micaela.
That's right, Lee. I spoke with a local man today who told me that he made a full recovery from COVID-19 after spending a few days at St. Luke's Hospital. He told me that his son, who lives in New Jersey, also tested positive for the virus. So when he started feeling what he describes as mild flu-like symptoms, he took them seriously. Here's his firsthand experience. Bryce Harbaugh is 76 years old.
I would say I'm a very healthy 76-year-old.
His doctor agrees.
This is what we doctors hope and wish to see in every patient. Unfortunately, the disease is very unpredictable, and some patients, in spite of us doing everything we can, may not do as well as Bryce.
Dr. Nazar Daboul is the chief of staff at St. Luke's Hospital. He says the hospital is fully staffed, well-equipped, and ready to care for COVID-19 patients. But he believes 50 to 80% of cases will not require hospitalization.
It's important to be concerned and be careful with this disease. However, do not panic.
Earlier this month, Bryce started feeling tired and achy. Over time, he developed a cough, a fever, and began experiencing shortness of breath. He went to the emergency room with his wife, Judy. At that point, he says he wasn't able to get a coronavirus test and ultimately was sent home, thinking he had the flu.
Very unusual for me to be as knocked out as I was and sleeping as much as I was sleeping and feeling as crummy as I felt for as long as I felt.
When Bryce's condition gradually got worse, he went back to the ER and asked for a chest x-ray.
Actually, I was declared a person of interest. And they said, we're going to keep you and have a real close look at this.
During his 4-day stay at St. Luke's Hospital, while awaiting test results, Bryce was kept in isolation. No one allowed in, and he wasn't allowed out. For him, that was the hardest part.
Being in isolation turns out to be just kind of, after a while, uncomfortable.
He wrote a letter to everyone he could think of that he came in contact with between March 8th and March 25th. So far, he says none of them seem to have it.
Sort of the miracle in this whole thing is that Judy, who was with me every step of this way, did not contract the disease.
Bryce is grateful to all of the healthcare workers on the front lines.
God is at work, but so are people, and they're really hustling.
He battled the coronavirus and won. Now he's feeling good and enjoying neighborhood walks with his wife.
I feel like myself again.
Bryce says when he was staying at St. Luke's Hospital, he was kept in a separate part of the facility with other COVID-19 patients. And he told me he was very impressed with the amount of protective gear his caretakers wore. Ultimately, the main takeaway he hopes everyone gets after hearing his story is just how hard the medical community is working and that it's vital to do what the experts are asking us to do in order to keep us all safe. Reporting live, Micaela Marshall, 13 ABC Action News.
And we love hearing about Bryce's outcome. Micaela, thank you. And here are the